rise in violence, personal violence, interpersonal violence, group-wise violence, violence targeted to communities, violence created by state institutions, and violence created by non-state actors. So the violence and its impact on public health is a transnational issue. And we know that the ethnic fundamental issues and fundamental conflict of ethnicity and its ethnic identity, external attack, and the criminality of organized criminality. So these are some of the violence issue and the war issue which has got public health implication, which we need transnational boundaries, transnational solutions. Next one, please. And one of the most prominent example of the need for a transnational boundaries and transnational effort to deal with the public health challenges, the COVID. And the COVID-19 is one of the classical example of global health diplomacy. The geopolitics, the nationalism, the weak institution caused by the increased negotiating effort, primarily supported by WHO, but all this collectively led to a failure to deal with the largest epidemic in the known history. So this is one of the examples of how the potential of health diplomacy and also the failure of health diplomacy, the experience or the lesson of the lessons of COVID-19 pandemic. And again, when you look at the WHO is one of the leading agencies which is coordinating the global health response. The WHO treaties, UN Security Council recommendations, Group of 20's recommendation, Group of 7, and this all obstructed by the diplomatic impasses by the two countries, United States and China. So how these certain power groups impacting on the global health diplomacy is also coming through our experience and example of dealing with the COVID pandemic. Next slide, please. When you look at the definition of the global health diplomacy, I try to combine some of the definition of the global health diplomacy. What I noticed is that there are several definitions. So I'm just going to present 3, then I'll give a commentary about those definitions. So global health diplomacy is a policy shaping process. That's one aspect of the definition. And second is, this policy shaping process is done through state, intergovernmental organization, and non-state actors. So the negotiation between state, intergovernmental organization, non-state actors. So these are some of the policy making process. And this policy making process or policy shaping process is to respond to the health challenges or utilize health concept or mechanism in policy shaping and negotiating strategies to achieve other political, economic, and social objectives. So this is one of the definition of the global health diplomacy. Now let's look at the next one. The next definition is, it refers to both to formal multilateral and bilateral decision making around health and the interaction between health and foreign policy concerns such as health security. And this also involving negotiation and cooperation among various state and non-state actors. So this is the second definition of a global health diplomacy. So the reference is given. Next slide, please. And again, global health diplomacy aims to safeguard people's health and welfare beyond the national boundaries. So this definition emphasizes them. Then beyond the national boundaries, what is the role of health? And it entails leveraging health-related concerns and strengthen bonds, encouraging teamwork and advance international peace and stability. So in this definition, one of the importance is global health diplomacy has got an implication for advancing international peace and stability. Global health diplomacy combines foreign policy interests and global health. This intersection between in the global political or foreign policy interests and the global health interests. So this intersecting area is global health diplomacy. And it brings diverse participants in the field of global health, political science, diplomacy, legal institution. So, and how that is impacting with global public health. So this is a third definition of global public health. The third definition. Next slide, please. Again, when you look at global health diplomacy, It's a multi-level, multi-actor negotiation procedure that shape and control the international policy landscape for health. So this is another definition. The international cooperation and collective action are necessary to achieve global health goals, which are practical for practically how it is practiced in the foreign policy affairs. And also, given their significant impact on the global security, stability, and socio-economic growth, health concerns are crossing national boundaries are the focus of the health diplomacy. Means the issues which are going beyond the national boundaries, the health issues which is going beyond the national boundaries are the focus of the global health diplomacy. Next slide, please. Again, what are the activities? There are different activities are being carried out under the realm, in the name of global health diplomacy. When you look at, what are the activities? I listed some of the activities here. The health promotion and the health advocacy at the global level. That's one of the set of activity. Second is different multilateral engagement. Multilateral means more than one country. Between two countries is bilateral. Multilateral engagement is different. At the same time, simultaneously, different agencies, different countries are being negotiated. And the next activity is a negotiation and cooperation of various activities. It's for negotiation for maybe reducing the price of medicine, access to medication, maybe for the regulatory mechanism for approval of certain medication. These are some of the negotiation cooperation. And also increasingly health aid and assistance, overseas or foreign donations or the intergovernmental support for development support is increasingly allocated for the health-related activities. And the last one is health security and emergency response. We know that disasters quite often calls for support beyond the border. So this is another area. So these are some of the list of activities being carried out under the name of global health diplomacy. Next one, please. So now who are the actors, who are the key players in the global health diplomacy? Number one set is the international intergovernmental organization, UN organization like WHO. WHO is specifically dedicated to the global aspects of health. UNFPA, family planning and population issues, UNICEF looking at the global diplomacy, how it can be applied in the issue of children's health. And many governments are increasingly playing in the health diplomacy role. And today we know that there are many governments, they appointed health ambassadors, and particularly focusing on promoting health diplomacy and taking it forward. I can say that European Union got a health ambassador, Australia got a global health ambassador, United States got a health ambassador, UK got a health ambassador. So how they are shaping the global health agenda is an emerging, very fascinating and evolving concept in which we have to keep an eye on that, how the global health ambassadors are influencing global health diplomacy. And increasingly, there are other diplomatic staff. They're also increasingly getting involved in health-related aspect. Health specialists are becoming foreign policy expert in many of the government their offices, particularly in New York office and also in Geneva office. I noticed that there are specialist diplomats, desk officers looking at only on health issues. And increasingly, we know the private sector is involving in the global health diplomacy. And these are private sector foundations, like a Gates Foundation, MacArthur Foundation, Ford Foundation. They are also getting into the area of diplomacy and impacting on the diplomacy, impacting on the global health agenda in various ways. And I'll elaborate on this issue later on. And increasingly, academics and research institutes are getting involved in the implications and the scope of a global health agenda setting and the influence of the global health diplomacy. For example, this lecture is an example of how academic institutions are taking interest in the global health diplomacy. And also civil society organizations. There are international NGOs like Save the Children, Amnesty International. These agencies also getting involved in the global health issues. As a public health students, maybe these are you may have to take some additional effort to understand how they operate, their job opportunities and their staffing issues. These are some of the issues you may keep an eye on that. Next slide, please. and the health diplomacy, where it is practiced and what is the venue. So this is an important learning objective. So if you want to get involved in the global health diplomacy, these are the areas, two areas. One is the agents I mentioned and where they're going to practice. So this is the area you have to look at it. One is the World Health Assembly. World Health Assembly is an annual event. The 192 ministers of health from the 192 countries, they come to Geneva to discuss about to set the global health agenda for the year. And normally it takes place about March, April, May, it varies. And the last Global Health, World Health Assembly had about almost 180 themes are discussed, and the negotiations are came. Negotiations are being practiced, and some of the agreements are signed. So WHO is the prominent global health advocacy, global health diplomacy institution. And the second is that World Trade Organization. And traditionally, World Trade Organization looked at only on the trade-related issues, but increasingly, drugs-related trade becoming an important interest for the World Trade Organization, and also the nuances of the production of the drugs, the patenting issue. This patenting of the medicines, patenting of the new medicine, patenting of the generic medicine. This also controlled and negotiated through the World Trade Organization. So World Trade Organization became an important venue for health diplomacy, to practice health diplomacy. And again, World Intellectual Property Organization is controlling the issue of intellectual property of commodities, the health-related commodities, and also many of them, for example, assistive technologies, how we can ensure access to those. And this is mediated through the diplomatic channel, or diplomatic skills are utilizing that. Then there are bilateral trade agreements. Many of the public health experts keep an eye on what are the public health implications. Now there are free trade agreements, and some of you know that India and UK is almost about to sign a free trade agreement with a significant public health implication. For example, NHS may buy generic medicine from India, and India also may buy from some of the medicine and equipment from UK. But what is the profit margin? Who is controlling it? And which medicines are generic medicine? Which medicine are not in the generic medicine? And who are the people who are going to produce and promote this? So these are some of the gray areas of this free trade agreement. And this is the area which the public health expert and the public diplomacy expert is called upon to look at and decipher. And another major area is the South-South cooperation is played as health diplomacy. South-South cooperation means the developing countries, they themselves form collaboration, they themselves form a partnership to look at health-related issues. And again, there are regional partnership. Regional partnership means there are like the SAARC, there are BIMSTEC, there are regional partnership, BRICS, another regional partnership. So those regional partnerships are increasingly contribute towards health-related decision-making. And those decisions also require diplomatic skills and expertise combined with public health and global health expertise. Next slide, please. Now, I just want to briefly mention about the Indian health diplomacy effort. The WHO and Ministry of Ayush agreement, and also what I noticed that Government of India has signed more than 100 health-specific MOUs with 100+ countries. That is a very significant move. And particularly, there is an agreement between India and WHO on Global Traditional Medicine Center. India is hosting the first Global Traditional Medicine Center in Gujarat. That is one of the diplomatic efforts. And also, this 100+ agreement are looking at what are the areas on production of the medicine, research collaboration, and innovations collaboration, and even the health tourism is utilized for looking at for expanding the health-related objectives and goals. Next one, please. And again, when you look at Indian bilateral health treaties, there are, again, when you look at there are more than 100 million bilateral health projects are focused on 20 countries across South Asia, Southeast Asia, and Africa. I tried to combine some of the list. And also, when you know that this project aims to improve healthcare delivery and build capacity in those regions. So this is the nature of Indian bilateral health treaties with global health implication. Next slide, please. And this is the headline of one of the newspaper. More than 29 million hydroxychloroquine doses brought by US have come from India, says President Trump. So India supplying medicine for the United States. Whether this medicine was effective or not, it's a different issue, but it becoming a big a diplomatic plus point for the India for supplying medicine for United States during the pandemic period. Next slide, please. So this is one picture from Afghanistan, probably from the Kabul airport. So the vaccines are supplied to Afghanistan, the COVID vaccine. So the COVID is one of the areas where India very effectively started utilizing diplomatic skills for expanding the goals of health. Next slide, please. When you look at Indian health diplomacy challenges, there is a danger in using diplomatic opportunities in the name of health. So this is one of the challenge. So it could undermine the technical goals. For example, the vaccine we supply, is it really relevant vaccine, effective vaccine, and efficacy of the vaccine? So there are many other technical goals of the bilateral aid. There should be mechanism to ensure that these are not overshadowed by the diplomatic objective. And again, we know that more than 100 countries received medical supplies, equipments, and expertise. Means we send doctors during COVID period to more than 100 countries. And also India's emerging global leadership, and it's attributed to humanitarian diplomacy and contribution to global health initiative. This Dr. Chattu and colleagues, they mentioned about it. But at the same time, when I looked at it, we need to nurture for the strategic leadership to take effective benefit from the India's emerging global health diplomatic maneuvering and also diplomatic initiative. Next slide, please. And also, I just wanted to make certain concluding remarks. The increasing role of developing countries in setting global health agenda. There are many countries are contributing towards health diplomacy. And addressing the health inequity, many of these countries are pushing for it. Health is the global trade, that our understanding about health inequity implication of global trade and the need for protecting the public health interest is also an area which is increasingly understood in the context of health diplomacy. And but in my major fascination is health could be used, or health is being emerged as a theme against ideology of war. We know that war is glorified through various means. Any war has got a significant public health implication. And to begin with, war is about murder, destruction, whereas public health is about encouraging, nurturing life. So this is a major distinction between public health and war. And the ideology of war is promoted through various ways, various means, through myths, through stories, and through mass media. Probably we should highlight the implication of public health and use health as a uniting theme to counter some of the ideology of war, some of the propaganda related with the war. So this is one area maybe increasingly we may have to utilize the need for public health and health diplomacy against the ideology of war. Again, we know that public health is still colonized, the ideas are colonized, the insights are being still under the colonial ideas. So decolonizing public health through global health diplomacy is another area which we need to explore. And most importantly, there are new public health practices, including the demedicalizing public health. Public health is being understood generally under the Department of Science, away from the medical fraternity. It is slowly moving to the social science and also humanitarian subjects. So demedicalizing public health is another area which is practiced in the global health diplomacy. Next slide, please. I just wanted to raise certain warning signs of global health diplomacy. The global health diplomacy is about power dynamics and the utilizing power, using power for benefiting each country's internal interest or a political interest, economic interest. And this may overtake the health objective. This may be one of the warning signs. And also the agenda setting, it could be sometime in undemocratic, means, see, for example, WHO agenda is set through an extensive consultative process. Any country, any minister of any country has got a say in setting the global health agenda, global public health agenda through WHO. And many of the UN agencies, there are channels of public consultation and also opportunities for engaging into the agenda setting process. Whereas certain private agencies, private foundations, they unilaterally decide what is a priority, global priority, and then they started financing that. So this is a major area of concern. Who should set the agenda for the global health, and who should utilize the global health diplomatic privileges, diplomatic tools, diplomatic mechanism to promote the agenda promoted through private institutions and which is articulated through non-democratic process. This will remain as a major challenge and warning. And I would say the health equity is still a concern. Health inequity between countries, within the country. And to what extent global health diplomacy can address this, that is one of the major agenda, major theme, it will remain. And again, unfinished Sustainable Development Goal 3 agenda. We know that 23 targets, and many of the targets achieved, some are not. But how do we utilize global diplomatic skills and expertise to promote unfinished SDG agenda? That's one of the warning signs. And being left out is a warning sign. And again, some of you know that WHO is negotiating for a global pandemic treaty. But the pandemic treaty, in one way, that is the success of a global health diplomacy. At the same time, that's also a sign of the failure to sign. It was supposed to be signed, agreed the last World Health Assembly, but that didn't sign, it is postponed. So that's also in one way a failure of the capacity of the global health diplomacy to get globally significant treaties being negotiated and being approved. And I would say this is one of the major warning signs of the limitation of global health diplomacy. Next slide, please. And in conclusion, what I want to say is that we need a social justice-oriented, equity-informed health diplomacy. The guiding values of the global health diplomacy could be social justice orientation and equity-informed health diplomacy. And also, there is a growing connection between health and foreign policy. This we need to have a major understanding about it, and we should explore our skills in that. And also, time for reevaluating the knowledge, ability, and resources the diplomatic and global health sectors required to accomplish their shared goals in global health diplomacy. Next slide, please. I just wanted to share some of my practical experience. So, I mean, one of my experience was assisting some of the governments in drafting a UN General Assembly statement. And UN General Assembly statements are, the ministry is one who is going to submit it for the head of the state. In one country, we worked with the ministry. The minister created a committee, and we created a 800-word statement because most of the UN declarations, according to the time frame, it should be presented in 4 minutes. But this statement is approved by the health secretary and the drafting committee, and we took it to New York. And the ambassador asked the minister, "Are you ready with your statement?" So ambassador said, "Let me take a look at it." Ambassador said, "Oh, there are many concerns about it," and he called one of the desk officer. Desk officer, very junior, fresh graduate, and just being appointed, and this person took it, and this person came back with the final statement. It's completely changed, like a diplomatic language, and the minister didn't have time to revise it because this just came few minutes before the presentation. So I'm just giving how this diplomatic maneuvering take place in some of the statements of the UN General Assembly. And also the second was working with the drafting of the position paper. That also is again, some of the words we use. In one country, that country, they promote abortion as one of the family planning method, or abortion is illegal. But at the same time, there is a strong political resistance against promotion of abortion. So they come out with a compromise of using a word called menstrual regulation instead of abortion. So this is drafted and agreed within the ministry. Again, this when we went to the New York, and that word is completely removed, and any reference about abortion as a means for sexual and reproductive health rights is removed. So again, how this negotiated. Second is the mentoring some of the senior politicians and diplomats. I had opportunity to have a one-to-one discussion about how that country's or that person's diplomatic practice of health diplomacy could be expanded. That in at least in one minister's secretary and the team, they asked me to look at organize ambassador meeting in Geneva to promote the minister as a global leader in public health. And I'm just another example of how global health diplomacy is practiced. And also global health diplomacy framework means where we can practice and what are the areas we can influence and how we influence. So creating such a framework is another area of contribution towards global health diplomacy. The last one is about working with the diplomats. I had the privilege of working with ambassadors meeting in Geneva, looking at the issue of access to drugs and promoting generic medicines through intergovernmental relationship. And for that, we had ambassadors meeting in Geneva. Similar thing, we had promoting Every Woman, Every Child campaign in New York with then UN Secretary General, and about 50 plus ambassadors came for a launching of such kind of a diplomatic maneuver. This is just to give some idea about those who are interested in getting into the global health diplomacy. Some of the examples which I shared. Next slide, please. This is some of the references, and if anybody is interested, you can look at. And next slide, please. Thank you. Yeah, this is now next is the question answer, or rather question and question. So you can use any of my, you can ask question now, or you can use any of my social media channel, and I'll be happy to engage or answer these questions later on. And this PPT itself, I'll be sharing it through and I just created a temporary WhatsApp group. After this meeting, I'll be removing it, but I'll share these slides with that group. And also one Imam, she also got a copy of the slide, and anybody is interested, they can use it. There is no patent copyrights. And if anybody is interested in further information, references, I'll be quite happy to assist you. Thank you very much. And thank you for the patient attention to my lecture. Thank you. Manimam, now anybody is interested in question, I'll be happy to take that. Thank you.
Yes, thanks a lot. I request now, the forum is open for question answer. So if any student want to ask question, unmute yourself and direct questions to our speaker.
Hello, sir. My name is Monisha Moses, and I'm a second-year student at MIT WPO. And I would like to thank you first and foremost for taking the time to be with us here today. And we've been hearing about you since our first year. So Vani ma'am is always all praises about you. So I want to really, really thank you for being here, and we are glad that we were able to attend this session. Sir, I just have one question, maybe two. My first question is, what do you think are the major or will be the major challenges in the future of global health diplomacy? And also, I would like to ask you, what advice would you give to future aspiring global health students and diplomats?
Thank you, Manisha, and thank you for the compliment. And thank you, Vanimam, for all the good word you put it for me, and appreciate that. And also, sometimes it's embarrassing, but at the same time, thank you. You asked two questions. One is, what are the emerging issues about global health diplomacy? And second is about what are the challenges, and what are the opportunities for the students of MPH. The challenges, let me come out with what are the challenges. One is articulating what is global health advocacy, global health diplomacy. That is going to be one of the major challenges, because right now, the global health advocacy is being negotiated, defined by developed countries. So then immediately there is a power equation comes in, and very few opportunities for the developing countries to practice health diplomacy. But at the same time, these countries, many smaller countries, less influential countries also utilizing health diplomacy. I'll give an example about it. During the Nepal earthquake, Bangladesh sent about 100 doctors to Nepal. If you convert that in the US 100 doctors sending in the Nepal, that may be $1 billion. That will attract immediate global media attention. But when Bangladesh sent 100 doctors to Nepal, that didn't even get a footnote to any of the international media. And just one giving an example about health diplomacy, the power imbalance in the health diplomacy. So next is about human resources for practicing health diplomacy. For example, none of the developing countries, they don't have a global health ambassador, whereas Australia got a dedicated global health ambassador. United States got a health ambassador, UK got a health ambassador. So most of the developing countries, they have dedicated human power, dedicated office, dedicated funding for practicing health diplomacy. This is the resources and the human capacity. And also I would say that within the foreign ministry itself, they might create a new cell with expertise, technical knowledge and information, conceptual clarity. So this is going to be the second challenge. The third challenge is that the convergence between Ministry of the Foreign Affairs or Foreign Ministry and the Ministry of Health. Because traditionally, Foreign Ministry, they don't give much acknowledgement to the Foreign Ministry of Health for their role in the global health. Because the global treaties and negotiations are done by Ministry of Finance and Ministry of External Affairs or Foreign Ministry. So in that process, they are looking at the public health implication of those trade agreements. So I can go on this many issues. So I'm just giving you 3 challenges. These challenges are also opportunities. Now, what the MPH students can do. One is the health diplomacy broadly falls under the global health area. There's a difference between global health and international health. International public health is dealing with the public health within the national boundary. Global health is dealing with public health at the global level. So within the global health, this health diplomacy fits in. So those who are looking for opportunities and job opportunities in global health area, specializing in health diplomacy may be useful because many of the intergovernmental international NGOs, they're also playing health diplomacy role knowingly, unknowingly. So if you acquire this expertise in health diplomacy, this may be useful for students who are looking for assignments in international intergovernmental agencies and also international NGOs, and even some of the leading national agencies. And my hunch is that even the national government will also have, for example, Niti Aayog may soon create a cell for global health diplomacy if they don't, and I wish they will create one. So these are the answer to your question. Thank you.
Thank you, sir. Thank you so much.
Hello, sir.
Yes.
This is Deepak, sir.
Yes, Deepak. Yeah.
Yeah. Sir, I just